evening. I'm your host, Arlana Shikongo, and welcome to another episode of Heartbeat. Tonight, we'll be discussing the variants of the novel coronavirus to get an understanding of what they are and how they are formed. In the recent third wave experienced by Namibia, many of the new infections were chalked up to the Delta variant, which is said to be more infectious because it is more transmissible. It may also be able to partially evade the antibodies made by the immune system to fight a coronavirus infection or a vaccination. However, research around this claim is still ongoing. Joining me this evening, we have an infectious disease specialist, Dr. Gordon Cupido, as well as a specialist of internal medicine, Dr. Flavia Mugala, who will help us unpack this and get a better understanding of what the variants are and what exactly they mean. Dr. Mugala, Dr. Cupido, thank you so much for joining me. During these corona times, we have to resort to Zoom, but I'm so happy that both of you were able to make the time to talk to us about this very important discussion this evening. I think to get us started, Dr. Cupido, I'll ask you first to just give us an understanding of what exactly a variant of a virus is.
So, variant of a virus, can you hear me? Sorry.
Yes, we can hear you.
So, variants of viruses arise because of what we call selection pressure. What it means is that when viruses multiply in the human body, they have to find ways of survival like all organisms. And by survival, it means that they become more transmissible and that they can evade the immune system of the those surviving those and be passed on to the next host. So when you've got viruses in the population, that population develops, every individual is infected and survives that infection will develop an immune response in order not to be infected. And once you've infected enough people in the population, then the number of new infections drops down, because the infection doesn't go as easily from one person to the next. So the only way for that virus to then come spread and therefore to change over the immune system. And this is how the process of But mutations means that the proteins will attach to the cells become more sticky, so you can solve easily and fight the immune system.
Okay, so then just to put that in summary, that's to say that a variant of a virus is essentially a mutation of the virus itself in which the genetic code has changed, no?
Yes, and the virus becomes more fit, often becomes more fit.
More fit, okay. So then, based on this, that means that there is a kind of a process of variation in which, you know, these mutations happen and these genetic code changes happen. And Dr. Mugala, I'm going to pose this question to you. If you could just explain to us a little bit this process of variation. I think on a very basic level, most people understand variation in regards to, for example, the HIV virus. That's something that's been around and that's something that we've talked about. If you can just explain this to us in a way that's a little bit more palpable for the average person to understand.
Okay, the HIV virus has been around for 40 years. And the HIV virus has got different types, which have been called clades. So the virus, for example, which is circulating, the HIV virus in Southern Africa is type C. The one which is circulating in Europe is type B. But you must remember that all these things came somehow from one source, and they spread around the world. So Dr. Cupido has told you that viruses undergo changes, genetic material change, and the genetic material is the one which causes mutations, and you get a different breed. And when that breed is better and can survive, then it produces more viruses like it. The breeds which are weak, they die off. So these changes in nature are happening all the time. And for the viruses, they multiply very fast. There are billions of particles of viruses in our bodies. It's not only like a few thousands. So those billions undergo genetic changes. And when those genetic changes are good, the viruses which are fit will survive. And they'll infect more, they'll be easier to transmit, and they'll cause more disease because they will overwhelm our defenses as they are much, much smart at surviving. It also happened with HIV, that the different types of HIV have got different levels of fitness. So like they found out that the HIV it was in Southern Africa was very, very fit. It was very aggressive and very virulent. And when they said that the HIV incubation period was like 7 to 10 years, we saw people who were infected within 3 years and they had severe symptoms of AIDS. So that's what is also happening to COVID. The viruses which are being produced by COVID, they undergo genetic changes, and those genetic changes promote the survival of the fit one. The one which can infect faster, is transmitted faster, and is more virulent. And that's why we are getting more virulent strains like the Delta virus.
Absolutely. And you had both mentioned this increased fitness to survive that the virus experiences as it mutates, right? And how this affects its ability to be transmitted. Now, a lot of people have been questioning, of course, we know, how COVID spreads, and we have a basic understanding of why, for example, mass gatherings have been reduced, or people are advised to avoid, groups or mass gatherings. Can you speak maybe a little bit to the connection of these variants arising and this connection that they have to mass gatherings or places where people congregate? How is it that when people congregate, this more transmissible virus now starts to spread into different hosts? What's the connection between the two?
Okay. The transmission of COVID, as we are aware, is through droplets, through which we can control by not getting close to infected people. If you look at HIV, it spreads mainly sexual transmission through blood products, mother-to-child transmission. And that one is more difficult to control in a public health sense. Because you cannot affect how people relate in relationships. But the COVID virus has given us a public health measure of how we can control it by not being exposed to people who are infected. So the more crowds we get, the more we transmit these strains, because people are close together. Like at funerals, they go through burial rites, which bring them close to the body of someone who is infected if they don't follow the public health measures that are advocated by government. And some of them, when they are close together with other people, like in a small room, you find more than 20 people, they are mourning, they are all sharing the same air. And some of them may be infected with the virus, and these ones transmit the virus to others. Which means that you have a big dose of the virus happening in the community. And the higher the dose of the virus in the community, the more is the genetic changes. Genetic changes occur with high levels of virus particles. So when we get close, like at funerals, when we go to mass gatherings, like maybe churches where people are not wearing masks and there's no social distancing, then we promote the transmission of the viruses, we promote the replication of the virus in many people, and we promote the genetic changes that can occur. So when a genetic change occurs and that virus is fit, then it will be easily transmitted to other members in the mass gathering.
All right. Thank you so much for explaining that, Dr. Mugala. In terms of the variants that exist, we know that for COVID specifically, we know that there are two types of variants, right? There are what they call variants of concern, and then there are variants of interest. So the variants of concern are the ones that we've been hearing about a lot recently, the alpha, beta, gamma, and delta variants, and then the variants of interest are the eta, iota, kappa, lambda, epsilon, many of which are not, in the Namibian sphere at this moment in time, thankfully. But Dr. Cupido, can you just talk us through these different variants a little bit? How do they differ, and what makes a variant one of concern and one of interest? What's the difference between the two? Dr. Cupido, I don't know if you can hear me. Your mic is still on mute, Dr. Cupido. Please unmute yourself. There we go. Thank you.
I missed the last part of your question.
Yes, I was just saying that we know that there are variants of concern and then variants of interest, right? Variants of concern being the alpha, beta, gamma, and delta variants, and then the variants of interest being the eta, iota, kappa, lambda, and epsilon. Those do not exist in the Namibian sphere, thankfully. But could you explain to us what the difference is between a variant of concern and a variant of interest?
So a variant of concern has demonstrated that it's potentially more, as you said, more infective. In others, it's transmitted more easily. And it may even have increased pathogenicity. In others, it can make people sicker.
Mm.
So, for example, if you look at the ones that you've mentioned, the alpha, the beta from South Africa, the alpha, which used to be the Kent, and then the gamma and the delta from Brazil. These are shown that, number one, they're more transmissible, because in every area where these have been found, they become dominant in a very short space of time, which means that they have got advantages over the other viruses. It also suggests that they can, with a smaller dose of the virus, produce the infection. In other words, somebody doesn't have to be in an advanced stage of infection with a high blood load in order to be infectious. And also then what happens is the virus has a greater, let's say, stickiness to the cell which it settles on. So small amounts of the virus can cause not just infection, but possibly disease.
Mm.
And of course, as we said before, these viruses may have changed in ways that the body does not recognize and cannot fight them. So this is what makes up a variant of concern. Whereas a variant of interest is one which has been picked up, which we know about the existence, but it's not clear that it shares a competitive advantage over the other variants.
Okay, thank you for that, Doctor. And then, of course, the variant of concern that has context in Namibia is the Delta variant at the moment, as it has been confirmed by our health ministry that this variant was tested in a number of samples over recent weeks. So for the Delta variant, how do the symptoms look different than, just the original virus that we were exposed to in the beginning? What symptoms should people be looking out for to be able to identify the Delta variant?
So the symptoms may, in by and large, coronavirus symptoms are indistinguishable from the common cold or influenza. So anybody with symptoms suggestive of a cold or flu in this period of time should be suspected of having coronavirus.
Mm-hmm.
Further to that, the loss of smell and taste, which we saw quite commonly before, seems to be less common now. The upper respiratory, the throat and the nose running, that seems to be less common. Often patients present directly with shortness of breath and chest symptoms, so cough, shortness of breath, and a fever. Some patients also present more with the stomach signs, diarrhea, stomach pain, and so on. And this is possibly because, this virus being more transmissible, smaller viral load, fewer prodromal symptoms, but because it multiplies so fast in the lungs and the other tissues that people could potentially progress much faster.
Okay. Thank you for that, doctor. And then coming back to, how a variant is formed in the body and kind of what is happening to the virus as this variant is formed, is it possible that a variant, an unidentified variant, not any of the ones that have been listed by the World Health Organization or CDC, is it possible that a new type of variant could arise in any population, like Namibia, for example? Dr. Mugala, if you can take that question, please.
Okay, thank you for that question. It's an important question because Dr. Cupido has told us that the first original COVID that came, where people had symptoms of cough, loss of smell, loss of taste, flu symptoms, has changed. Now we are dealing with some people come just chest pain, short of breath, and they didn't report any symptoms of flu. And all these were variants that arose from the original virus. So the changes that are happening now in viruses have not stopped. It's not like the Delta virus is the last one. But we can make it stop. So that as long as the viruses undergo replication, and during the process of replication, the genetic material changes, we shall get worse viruses, and they'll become worse with time if we don't control it. So that we may have viruses which are more genetically fit than the Delta one. They are more infectious, they are easily to transmit, and they are also very virulent, causing very severe disease. We have the tools in our boxes to decide on that. If people get vaccinated and they are protected against COVID, it means that you have less people with COVID in the community. You will have what we call herd immunity, and people are protected from infection. And those who have infection, they may have a mild disease, meaning that the viral burden is much lower and less mutations, and that can protect societies. Because right now, what is happening in those countries like USA, they've noticed that Delta virus infections are only severe in those patients who are not vaccinated. They are the ones who are entering ICUs. People who are vaccinated, they are still protected against Delta virus, though they were vaccinated against the original one. So there is a protection, and that means that we're using vaccines. And when we don't use vaccines, we are breeding more viruses, which will undergo changes, and the fit ones will damage society. Thank you.
Dr. Mugala, on that point, as you mentioned, what we've seen so far in the data that's been collected, that the Delta variant ends up affecting people who are not vaccinated far worse than people who have been vaccinated. I know that thus far the research and the studies are quite limited, but at this point in time, what do we know about the efficacy of the vaccines that are on the market to these variants, specifically the Delta one, as it applies to us?
Okay. Can you hear me?
Yes, I can hear you, doctor.
Yeah. So the vaccine is not as effective against the Delta virus as it is against the other viruses, the initial virus that was available. But still, there is a lot of effect it has, because it, like I've mentioned, that they are not seeing that the people who are fully vaccinated